Hi lovely people, welcome back to the channel. It's yet another day and an opportunity to study. We all know it's very crucial for our lives as humans to get ourselves abreast. I mean, we need to be updated with the current information arising as reference to our health. Women, get closer. Let's learn something new today. As I made mention in my last video, we're going to talk about what a normal pregnancy is. Not all pregnancies are normal. Some are obviously abnormal or experience abnormal issues arising. And so, if you get to know all of these in case you are pregnant or you want to achieve pregnancy and it happens that you're experiencing anything different apart from this, then nobody will tell you to see a physician. Get right into what a normal pregnancy is. So there are 4 determinants that we need to consider talking about this issue with respect to pregnancy. First of all, where is the embryo embedded? Okay. Second thing is, where is the placenta also implanted? And the third, are you experiencing any bleeding apart from implantation bleeding? Don't worry, I'm going to teach you what an implantation bleeding is, the difference between menses and implantation bleeding, so that you don't get yourself confused if perhaps you are experiencing a normal menstrual cycle or bleeding, or it is implantation bleeding that you are having. And the last, the duration of the pregnancy. I'm going to take all of these one after the other and explain to the best of your knowledge. The first thing that you're going to talk about right now is the location of the embryo. The embryo is the formation of the baby in its earliest stage, okay? So where should the baby be embedded? Is it the uterus, which is the womb? Is it the fallopian tube? Or even outside or inside the woman's abdomen? In a normal pregnancy, the baby should be embedded or be implanted in the uterus. Secondly, now that the baby has been formed and in the uterus, where should the placenta be implanted or be embedded also? This could result in a huge problem if it happens to be embedded at the lower part of the woman's womb. It is something we will talk about, and I do not wish that for anybody because it makes normal delivery or spontaneous vaginal delivery a problem. And so we are expecting the placenta to be embedded at the upper portion of the uterus or even the site. But then it all depends on the degrees or at the level that has been implanted at the side, but never at the lower portion or closer to the cervix of the uterus. The third is the woman experiencing any form of bleeding? Yes, implantation bleeding is there, which is normal. Not all women experience that, okay? But then, if it is not implantation bleeding, we don't want to experience any spotting. I'm going to teach you what implantation bleeding is, when to expect it, and the difference between a normal menstruation and implantation bleeding. More often than not, some women tend to confuse themselves with pregnancy and then menstrual bleeding. The moment maybe she misses her menses and then she feels like, within maybe 10 days into her menstrual cycle, she started seeing some spots and she feels like, I've experienced bleeding and I'm menstruating. Meanwhile, she was pregnant, but because she didn't have any knowledge about implantation bleeding, she thought it was her menses, and then pregnancy happens to grow and then gets older without her knowledge. The fourth thing that we need to talk about is the duration of the pregnancy. I've said in my last videos or my previous ones that every pregnancy, the normal ones, should last 37 to 40 completed weeks, all things being equal. Any period apart from this, if the woman delivers or if the pregnancy is being aborted or doesn't get to the point that we want the woman to have, any moment below 37 weeks or above 40 completed weeks, it is said to be abnormal. So in summary, I wish that all my clients experience a normal pregnancy So 1, the embryo or the fetus should be embedded in the uterus of the woman and not in the fallopian tube, never in the woman's abdomen. Secondly, the placenta should not be implanted at the lower portion of the uterus, but in the upper portion of the uterus. The third, don't experience any blood loss. If any is happening right now, please get to the hospital, see your midwife or talk to your physician, and we are there to help you. And the last is, let's pray and then hope that all things being equal, our pregnancy or the baby is being kept in the womb for 37 to 40 completed weeks. Thank you so much. I hope you understand. If there is anything bothering your mind, don't forget and don't hesitate at any point in time. Just hit up in the comment section and I'll be right there to give you the right answer to these questions. Thank you, and then see you in my next video.